in this room in the state of North Carolina, we're currently located in what's known as the stroke belt. Basically what that means is geographically, the southeastern United States has the highest incidence of stroke in the entire United States. I have some statistics from the American Heart Association that are the Heart Disease and Stroke Statistics 2009. And as I read these statistics, I want you to think about your mother, your father, your sister, brother, family, friend, or coworker. On average, every 40 seconds, someone in the United States has a stroke. On average, every 3 to 4 minutes, someone dies of a stroke. Stroke is the third leading cause of death in the United States and a leading cause of serious long-term disability. In 2005, stroke accounted for 1 out of every 17 deaths. That was about 144,000. 56,000 of those deaths were male and 87,000 were female. Although these are only a few of the statistics about stroke, it shows what a devastating effect it can have. Knowing the signs and symptoms of stroke, what stroke is, and how we can prevent it, and the risk factors can help save lives of stroke victims. According to the Heart and Stroke Association, a stroke is when a blood vessel bringing blood and oxygen to the brain ruptures or is impeded and causes cell death. According to the National Stroke Association, there are 2 types of stroke. The first type is ischemic stroke, which basically is when a clot or fatty deposit or plaque stops the blood supply to the brain, causing cell death. And the other kind is hemorrhagic stroke, which is the blood leaking into the tissues, which also causes cell death. Either of these types of stroke cause brain cell death, and oxygen does not get to the tissue, so it causes brain dysfunction. Okay, now that we have a better understanding of what stroke is, let's learn what stroke looks like. There are different signs and symptoms that you would look for in a person having a stroke. One of the ways you can remember is the 5 S's, so 5 suddens. You would have sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Trouble seeing in one or both eyes. Sudden confusion, trouble speaking or understanding. Sudden trouble walking, dizziness, loss of balance or coordination. And sudden severe headache with no cause. There's another way to notice if someone's recognize and respond to someone who's having a stroke, and that's using the FAST method. So basically, anytime you think someone's having a stroke, you want to respond quickly. So using the acronym FAST is one of the ways to assess that person. So you'd want to look at their face and ask them to smile, and if one side of their face is drooping, then that would be a sign that they may be having a stroke. You want to look at their arms second, so you'd ask them to raise their arms, and if one falls or they can't hold them up, that would be a significant sign. You want to assess their speech and ask them to say a simple sentence like, "You can't teach an old dog new tricks." If they have any slurring or they can't get the words out or word finding difficulty, that would be a significant sign. And then you want to think about time. Any of the above, or you're just not sure, you want to call 911. You also want to think, as far as the time goes, you want to think about the onset of those symptoms and try to make aware, if you have a watch, or ask someone about the time, so that if EMS asks, you're aware of the onset of when these started. Some of the treatments for stroke are time sensitive, so if they're after a 3 to 4 hour period, they won't be able to get some of the treatments for stroke. Stroke strikes fast, you should too. Knowing these signs and symptoms can mean life or death for a person experiencing a stroke. It is important to act and call quickly. Some of the treatments for stroke have a time limit, and if you have any doubt, call 911. Now that we know what stroke is and what it looks like, let's look at how we can prevent it. According to the National Institute of Neurologic Disease and Stroke, some of the risk factors basically are the same as your risk factors for cardiovascular disease and other things. You want to manage your diabetes if you have diabetes. If you have diabetes in your family, you want to have regular doctor's appointments to see if you become diabetic or at risk of diabetes. You want to eat right. That's basically just maintaining a healthy diet, as everybody should. Control your blood pressure. Unfortunately, African Americans have a higher risk for high blood pressure, so therefore they have a higher risk for stroke as well. Exercise, and if you smoke, don't smoke. Quit. References. If you take anything away from this session today, I hope that it is how important it is to know the signs and symptoms of stroke and to act fast. Each moment that passes for a person experiencing a stroke can define their future, whether it be death or severe disability. Time lost is brain lost.